Get all that pressure taken off the nerves.
Oh my God. Watching your videos was like freaking me out, but like being here and done it, it's amazing. Like so much worth it.
Right?
Yes.
What did you feel with that wise strap? Like how would you, like literally somebody who's not...
Oh, I feel like literally I felt that in my whole body, and I felt like just everything just, I don't know, just weird, but in a good way.
Yeah.
Like it feels good.
Come on up.
Oh my God, thank you so much. Brand new, brand new.
That's how you
That's crazy.
all the time. So let's see, coming from Sarasota, like you said. Ooh, never been adjusted before?
Never.
Okay.
That's why I'm so nervous.
Oh man, all right, neck, shoulders, and then mid and low back.
My back is just, I have scoliosis, so
Okay.
I just always suffer from lower back pain for like 3 months ago. It just has gotten worse.
Really? What do you feel like on a day-to-day?
Oh, I tight and then like just pain, just like so stiff.
Okay.
Stiffness.
So that lowers
It's
really
more
the...
on my lower, yeah.
Okay. Anything ever
No.
going down? No. So it stays in the low back.
My lower back.
Okay. And that's the main one. And then upper, what do you
And
feel?
then just tense.
Okay.
Right there.
Kind of neck into the shoulders like that. Okay. But never been to a chiropractor. Okay. How are movements? Like if you look up, look down to...
I feel it, but nothing.
Okay. What about like with...
I do feel the pain.
Okay.
Just, yeah.
Okay, so that one you actually notice.
Yeah.
Okay. So in the neck, not so much of anything with the movements there, but okay. Oh, good. All right. So then today is going to be fun because you've never been adjusted before. Okay. Let me have you go face down on the table. Take a look at that leg length. All right. So your left leg is actually pulling a little bit shorter than your right one. Let me know if there's any pain or tenderness. Okay, definitely a little bit of tightness in here. Now, when did you find out you had scoliosis?
Oh my God, when I was young, like 12.
Okay.
But it's nothing like we're in need of surgery. So.
Okay. Any pain with any of this?
Yeah.
Starting to get?
Mm-hmm.
Okay. Okay. So this part was where you, okay.
Like 2 weeks ago, I couldn't even bend down.
Are you serious? Oh
I
my.
had my son just massage me.
Alright, we are going to start up top here. Make sure the hair is out of the way. Good. Alright, so we're going to clear out the lower cervical, upper thoracic spine here. Get all that pressure taken off the nerves.
Oh my God. Oh my God.
There. There we go. Okay. And then we're going to start with the upper thoracic, then middle, then lower. Good. There we go. And now that lower one. So this one, I want you to take a deep breath in and out. There it was. Good. Let me have you sit up on the table and then bring one leg, yep, on each side. That's what I was just about to ask. How did that feel?
Amazing.
See, and you waited all this time.
I can't believe it. Being a chicken.
Well, better late than never.
Oh my God, yeah.
Okay. So we're going to bring one arm up, bring that other one up. So with this, it's going to be a seated lumbar adjustment. So you'll feel relief through the upper lumbar and then at times even in the hips as well.
Oh my God.
There we go. And then I want to do a little bit of soft tissue work on the traps up here. Yeah, this part kind of sucks because it's like a good hurt. It hurts while you're doing it, but
you feel that relief.
yeah. Okay, let's check the shoulders here. Good. There we go, good. Okay. All right, let me have you go face down again for me. Better with the leg length. Still about a millimeter short though. But yeah, no, it's getting better. But yeah, now we're gonna work on both the right and the left side joint, the sacrum, and then going up that lumbar spine and a little bit into the thoracic as well. legs are completely balanced now.
That's insane.
Let me have you flip onto your back. Perfect. Okay. Relax your legs. So with these, we're gonna do a leg pull. You'll feel some release in the ankle, the knee, going up to the hip. There we go. Perfect.
This is a scary one.
This is the best part right here. Lift up.
Oh my God. Holy moly. Oh my God. That's crazy.
What did you feel?
Oh my God, such a big relief. That's crazy.
Now I know for you, obviously.
Oh my God.
Being adjusted
Never. This is crazy. Watching your videos was like freaking me out, but like being here and done it, it's amazing. Like so much worth it.
Right?
Yes.
What did you feel with that Y strap? Like how would you, like literally somebody who's not...
Oh, I feel like literally I felt that in my whole body, and I felt like just everything just, I don't know, just weird, but in a good way.
Yeah.
Like it feels good.
And then you can turn that way. We're going to use the vibration again, and then I want to do one more Y strap. Make sure we got
I don't even feel anything down there no more.
Really?
At all. I just can't believe that.
Okay, and then I'm going to have you turn and face this way again. And then come on down. Perfect. And rest. What did you feel?
This, well, less obviously than the other one, but you can tell that I still had that.
I heard a couple.
Yeah.
But yeah, the first one was definitely...
Oh my God. But I do feel good.
Yeah, just rest for a moment. Yeah, I mean, not even is this the first time getting the Y strap done, it's the first time.
On everything.
Yep.
Everything. Gilbert was the one that sent me here.
Oh, really? Okay.
Killed her.
How do you feel?
Brand new. Literally brand new. It was worth it.
Good. Cause that lower.
That was intense. That was like, I literally couldn't even, I feel like an old lady. Like even in my car, I had like one of them back thing. It was crazy. It was horrible. Yeah. Oh my God, I really appreciate it.
Yeah, cause you're too
Now I can
young
dance
to be-
again. Literally, I couldn't even dance.
Oh my God.
Oh my God, yeah.
All right, come on up.
Oh my God, thank you so much. Brand new, brand new.
That's how you
That's
make me
crazy.
feel all the time.
So how often should I do this?
I would say average patient I see roughly about every 3-4 months.
3 or 4 months?
Yeah.
Okay.
Yeah, but obviously knock on wood, hopefully no trauma,
Yeah.
accidents, you know.
Oh my God, yeah,
like
yeah.
that, but yeah.
Okay. That's crazy. Oh my God, can I hug you?
Yeah.
Oh my God, thank you. I really appreciate it.
You're welcome.
Thank you. Oh my God, this was amazing.